Today, we're going to do something a little different. We're going to decode a document that honestly can feel like it's written in another language, a cancer radiology report. The goal here is to cut through all that medical jargon so you can really get a handle on how doctors track and, fight this disease. So, picture this. You're handed a medical report, it's full of jargon, and you're just staring at it thinking, where do I even begin? It's a feeling a lot of us know, getting this super important health document that just feels impossible to understand. Words like hypodense lesion or pleural enhancement, they can be pretty intimidating, right? So where do you start? Well, the answer is always with the patient's story.
All right, let's dive right in. This whole case revolves around a single CT scan, but it has a really critical purpose: to figure out if a cancer treatment is actually working. Before we get into what the scan found, you got to understand the patient's context. That's everything.
Okay, so here's our baseline. We're looking at a report for a 59-year-old woman. She was diagnosed with metastatic lung adenocarcinoma. Now, she's been on a targeted therapy drug, it's called gefitinib, for about 6 months now. This current scan from February 2026 is being put side by side with her last one from August 2025, and it's all to answer one single key question. How has the cancer responded to the treatment?
Before we go any further, let's just make sure we're all on the same page with the diagnosis. Adenocarcinoma is a cancer that starts in glandular cells. But that word metastatic, that is absolutely crucial here. It means the cancer isn't just hanging out in its original spot, the lung. Nope, it's spread to other parts of the body. And that's exactly why the scan covers the entire torso, from the brain all the way down to the pelvis.
The report itself is structured by body part, which is pretty logical, so that's exactly how we're going to walk through it. And thankfully, this whole journey starts with some genuinely good news from the brain scan.
The very first finding is, it's clear and it's positive. Absolutely no signs of cancer in the brain. Look, for a patient with metastatic disease, this is a huge relief. The report confirms it. No lesions, no signs of trouble. It gives us a clean slate to start the rest of the assessment.
Okay, so now we move down to the chest, or what the report calls the thorax. This is ground zero. This is the area of the primary cancer, and you can feel the tone of the report shift immediately. This is where the main battle is being fought. And before we get lost in the details, let's just start with scale. The largest tumor they found in the chest is 5.5 centimeters. To put that in perspective, that's over 2 inches across. That single measurement tells you right away we are dealing with a significant mass.
So here's the tough part. The findings in the chest, they're not good. The report is pretty clear that the tumors on the lungs lining have actually worsened and grown. And that 5.5 centimeter mass, it's so close to the heart that its borders are literally blurred. On top of that, there's widespread inflammation, the nearby lymph nodes are enlarged, which is a big sign the cancer is active there, and the right lung itself is really suffering. It's got reduced volume and parts of it are even collapsing. This is a very clear signal of disease progression in this area.
This slide really helps to pinpoint exactly where the problem is. A pleural-based lesion. It sounds complicated, but it isn't. Inside the spongy part of the lung we usually think of. It means the cancer is growing on the pleura, which is this thin membrane that wraps around the lungs. And it's this specific location that's causing all that inflammation and thickening they're seeing on the scan.
All right, leaving the chest, the scan continues its journey down through the rest of the body. And this is where the story gets more complicated. It's a real mix of stability and, new questions.
This is a perfect example of what doctors call stable disease. So the report points out a lesion in the liver. But when you look at the size from 6 months ago and compare it to today, it's virtually identical. It hasn't grown. And in the world of metastatic cancer, no change is often considered pretty good news.
And that same story of stability continues as we move down into the pelvis. The report mentions several masses in and around the uterus. But just like that liver lesion, the radiologist's conclusion is no interval change. They haven't grown, they haven't spread. It suggests the treatment might be holding them in check, at least in this area.
But just as we're settling into this pattern of stability, the report throws us a real curveball. A new lesion has been found on the iliac bone, that's the large bone of your hip, and its meaning, it's not immediately clear. Is this a good sign, or is this a bad one? This is such a fascinating glimpse into the real detective work of radiology. The new spot is described as sclerotic, which just means it's hardened or dense. Now, this can happen when a bone metastasis is actually healing because of the treatment, which would be a fantastic sign. But it could also just be a new metastasis that happens to be sclerotic. The scan itself can't give a final answer. It can only lay out the two possibilities for the doctors to consider. So, let's recap. We've got worsening disease in the chest, things are stable in the abdomen, and there's this new ambiguous spot on the bone. How on earth does the radiologist tie all of this together? Well, that's what the final impression section is for.
And here it is. This is the headline of the whole report. The radiologist leads with the most critical finding: worsening right pleural metastasis. The cancer in the chest lining is getting worse. They also add this term lymphangitic carcinomatosis, which is a very technical way of saying the cancer seems to be spreading through the lungs' tiny lymphatic channels, and that explains all the inflammation and progression they're seeing.
This table really brings the whole complex picture together at a glance. You've got a profoundly mixed report. One area, the thorax, is clearly undeniably worsening. Two other major areas are stable, holding steady. And then you have a brand new finding in the bone that needs more investigation. The big takeaway here is that the treatment seems to be having very different effects in different parts of the body.
And all of that leaves us with the ultimate question, doesn't it? This report isn't a simple pass or fail. It's a complex, detailed map of the patient's current state. So the real work for the oncology team begins right now. They have to weigh the progression in the chest against the stability elsewhere to decide what to do next. Do they continue the current treatment? Do they switch to something new? Do they add another therapy? This is the tough reality of managing complex cancer care.